Hey guys, before I start this video off today, I just want to take a second and introduce myself. My name's Kaylee and I'm a radiology tech major at the University of Iowa. Today we're going to be talking about one of the modalities of radiology. So in medical imaging, there are 6 different modalities, and modalities are basically different sections of the radiology department. So within those 6 sections, there's CT, MRI, ultrasound, PET scan, x-rays, and digital mammogram. All these modalities play a really special role in medical imaging, but it really depends on what the patient needs, whether that be x-ray to determine a broken bone or fracture, or MRI to determine an ACL or meniscus tear. Today we're going to talk specifically about mammogram and why it's so important when it comes to women's health. The biggest reason why it's so important is it's the most effective way for determining breast cancer in women. Although many women tend to put it off sometimes due to it just being awkward or uncomfortable, this is a simple checkup that'll make the difference between determining if you catch it soon enough and you can be diagnosed at stage 1, or if you caught it too late and now you're to the point where you're stage 3 or stage 4. This is what a typical breast imaging machine will look like for a patient. So up top you can see 2 clear things, and in the middle you can also see another clear thing that looks like a box. Those are actually the plates that will hold your breast in place, or in a sense squish it. The reasoning for the plates and essentially squishing your breast is to ensure that all the different angles are accounted for, whether that be the front and top of the breast or both sides of the breast. So once the breast is squished with those 2 plates, a low dosage of x-rays will then be sent down onto the breast that will actually create the image of the breast tissue. So in this picture, we can kind of see that process of squishing the breast downward so you get the top and bottom view, but also what the dosage of x-ray would look like going onto the breast as well. You can also see in the bottom right-hand corner that there is a picture of that breast after the imaging was produced, and you can also see the little dot that is identifying the little cancer cell. Those would be the type of things that the doctor would be looking for when considering a deformality. Although to us, that may not look like a deformality and just a part of the breast tissue, those are the simple things that a doctor would be looking for. Something that looks abnormal to the breast tissue, whether that be a circular speck or something as large as a golf ball or softball size of a lump. So here are some more examples of what a possible deformality would look like. In the first 2 pictures, you really can't see a deformality and maybe questioning, are those really deformalities? But in the 3rd picture, you can definitely tell that the red box is circling something that does look abnormal to the breast tissue. While in the first picture, the deformality that is highlighted doesn't look like a deformality at all. Like I mentioned earlier, it simply just looks like it's a part of the breast tissue. But you can see that there is a little speck, and like I said earlier, that is something that the doctor would look for, even if it's as tiny as that. While in the second picture, we really can't tell where that deformality is. To us, that may just look like normal breast tissue, but for a radiology doctor, they would definitely be able to pinpoint where the deformality is in that box, unlike. Concluding the video today, I just wanted to emphasize on how important medical imaging is, not only to women, but to everyone else. Although many people assume that we just push buttons all day, we do a lot more than that. We help in determining brain tumors, any type of cancerous cells or tumors that may be visible with radiation. We determine broken bones or fractures, or even cancerous cells with mammograms. Thanks for watching today, and don't forget to thank our radiologist. And remember, we're not just button pushers. And don't forget to get your annual mammogram if it's that time to prevent any breast cancer.